Madam Secretary, thank you for being here. Thank you for the excellent work you've been doing under very difficult circumstances. Just two lines of thought that I want to pursue. In the health care reform bill, some of us, including Senator Harkin and many other people on this committee, worked very hard to expand community health centers because we believed that one of the great crises in this country, and one of the reasons that 45,000 Americans die every single year, is they don't have access to health care. And in fact, some of those people even have health insurance. So we saw a crisis in primary health care. As a result of this legislation, we doubled the number of community health centers, opening up an opportunity for 20 million more Americans to get good quality health care, dental care, mental health counseling, and low-cost prescription drugs. Can you give us maybe an update as to how progress is coming along in terms of the community health center program?
Certainly, Senator, and again, I applaud your leadership on this issue. It's an incredibly important framework for healthcare improvements across the country, and I try to visit health centers every trip I make, and they are impressive neighborhood community organizations delivering high-quality, lower-cost care to millions of Americans. We are working very quickly to implement the strategy that's laid out over the next 5 years. The first step was to put money in the pipeline for important improvements and additional services, additional dental care and mental health care. We've putting out the new Access Point grant proposals that will be released this year and over the next several years, and also an important feature of the community planning proposals are going out the door in 2011. So those communities which haven't quite gotten the wherewithal to actually make the full-blown proposal will have an opportunity to bring together providers and community groups. But certainly that footprint of community health centers expanding across the country and new sites. So it will be both new access sites and mobile sites connected to existing health centers, whether that be in schools or vans or other.
And I should tell you, Madam Secretary, that in Vermont we're making real success. And if you're really nice to us in the next couple of years and you grant a few more requests, every part of the state of Vermont, every county, every area in the state of Vermont will enable its people to have access to community health centers, which we think is a real step forward. Would you be in agreement with a study coming out of George Washington University which says that the investment that we made, in fact, is going to save substantially more money than we spend because we're going to keep people out of emergency rooms, we're going to let them get to a doctor when they should, not get very sick, and end up in a hospital at great cost. Does that?
Well, I haven't seen the study, but I certainly have seen that practice in place. And in fact, some of the most creative and I think beneficial work going on around the country is community health centers working in collaboration with community hospitals, right, and appropriately sort of reassigning folks to care that
rather than
is preventive
overutilizing
care.
an emergency
You bet,
room.
you bet.
All right, well, let me switch gear and pick up on a point that Senator McCain made a moment ago, and I'm sorry he's not here. As you may know, and I know the state of Vermont is giving serious thought to moving forward toward a Medicare for All single-payer program. Our approach and our request for a waiver may be a little bit different than Arizona's. We do not want to throw people off of health insurance. We want to make sure that every person in our state is covered. We believe that approach, and there was a study that just came out by Dr. Shao, who you may know is an economist at Harvard who developed the healthcare program in Taiwan. We believe that we can save many, many hundreds of millions of dollars through a Medicare for All single-payer program. And I know that we have to work on that waiver legislatively. That's not something that you can give us on your own. But would you be prepared to work with us as we walk down that road saying that in a federalist nation where we have 50 different states, that maybe the nation can learn from what Vermont or other states are doing with increased flexibility?
Well, Senator, I was appreciative of the meeting that you attended with your newly elected governor and applaud the work that Vermont has done. States across the country often have been well ahead of the federal government in terms of creative health strategies to expand coverage to citizens, and we very much encourage the kind of flexibility, the state-based approaches which this bill is built around, and I look forward to working with you.
Our goal there is to maintain the high standards of the national legislation, but to give states flexibility to show how, in their particular areas, they may be able to do it better in a more cost-effective way. So we'd appreciate working with you.